Indiana's news leader, Andrea Moorhead, John Stair, and Chief Meteorologist Chris Wright. This is Eyewitness News at 5 o'clock.
And on the Healthbeat tonight, we're talking about a brand new approach for treating your children who are diagnosed with spectrum disorders. Our Healthbeat reporter Anne-Marie Tiernon joins us now with more on brain balance. We're really talking about what you eat that can affect your brain.
Well, that's part of the solution here. You know, it's where the Greeson family in Zionsville went for help. It involved, in part, revamping the family diet, and the results, they say, are promising. Mitchell Greeson is like 10% of American boys diagnosed with ADHD. He is getting alternative treatment at Brain Balance after first trying medication that his mother says made him emotional, even dopey.
It was extreme. We lost his personality. I think it's probably easier to go ahead and medicate because that is what the pediatricians are recommending right now. That's kind of the path they steer you toward. But I wanted to make sure that I could figure out what was causing the problem and not just mask the behavior.
Finding the source included a blood test that revealed Mitchell has food sensitivities.
He had 5 foods. He had dairy, eggs, chicken, and celery.
All right, Mitchell, you ready to go?
A nutritionist helped modify his diet.
Well, these are a lot of Mitchell's favorites.
She also eliminated excess sugar, artificial sweeteners, food coloring, and gluten.
And what we see is when we eliminate certain foods, their behaviors change.
And one of her tricks is making mac and cheese with corn or rice pasta and using diet cheese.
Diet is really good. It's one of the cheeses that melts, and you can get it in cheddar and mozzarella. They're going to be lit up over here on this left side, okay? Because they're going to work your right brain.
Mitchell is 6.
Begin.
And he also started motory and sensory therapy after cognitive tests revealed that his right brain skills were behind for his age, making him appear immature.
So we look at the left brain skills versus the right brain skills.
Mitchie, woohoo!
We put him through a 12-week program, 3 times a week, 1-hour sessions of sensory motor and academic cognitive until that right side comes up to the side of the balance of the left side.
I just want to tell every parent, try this because it's made such a big difference in something I would have never even guessed.
Okay, ready? We're going to do both hands.
When he started the program, he had a diagnosis on a scale called the Brown scale. He showed that he did have ADHD. After the program, he no longer registered as ADHD on the Brown scale, which is something that we see in Brain Balance a lot, actually 82% of the time.
He was just bouncing. He couldn't even sit like he's doing now, even though he's more what I would say normal little boy right now. I mean, he would not even be able to sit like this before.
And Mitchell can feel the changes too.
I was getting in trouble a lot.
And what about now?
No, I'm not really.
And that's a good feeling. Mitchell's in kindergarten, and he says he enjoys facing less consequences for his behavior. The mother, Beth Greeson, says she really didn't appreciate the changes were related to food in part until she tried to reintroduce some of the foods back into the diet, and she says she saw that difficult behavior once again. If you'd like to learn more about this program, go to WTHR.com and click on Health. Back to you.